Okay, you guys, this is acquired cardiovascular disorders. Infectious and inflammatory cardiac disorders. We're really not going to go over those, but some of the things we'll do for these, you'll see in the other things. All right, so hyperlipidemia. So with hyperlipidemia, we want to make sure we identify kids at risk and treat them early. And how do we do that? We're going to look at their diet and their lifestyle. We're also going to do labs and see what their LDLs, HDLs, and the rest of their blood levels look like. For pediatrics, we do not know long-term effects of being on medications to help decrease your cholesterol. So our first initial thing is to try treatment with lifestyle modifications, which all of us should be doing if we have these issues. So restricting intake of cholesterol and fats. So teaching these families to pick good, healthy foods, healthy fats versus unhealthy fats. Increasing their whole grains, fruits, and veggies, finding that good, happy medium. So maybe teaching them how to use My Plate or how to use different dietary tools so that they can make better food choices. Another big thing is that movement. We need to make sure these children are getting at least 60 minutes of exercise 5 days a week. So we'll want to look at how much activity time they're having at school and after school and help find different ways we can get them more active. Of course, stopping smoking or avoiding secondhand smoke. So if it is an older child that is smoking themselves, we're going to give them lots of education on why they shouldn't, and then talk to families about secondhand smoke and how that can affect their children. If diet modifications and lifestyle modifications do not do the job, we will go ahead and give them. These are two of the common medications we might try. All right, systemic hypertension and essential hypertension. Essential hypertension, we don't always know the cause of it. Is it structural abnormality, or is there some underlying patho? Secondary hypertension, we can identify the cause. This could be renal disease, genetic or environmental factors. Generally, in terms of hypertension in pediatrics, it is secondary to an abnormality or underlying pathological condition. Like I was mentioning, renal disease, cardiovascular disease, endocrine and neurologic disorders. What are we going to do for these kids? Well, we should be checking blood pressures on all kids greater than 3 years of age. And what did we learn from health assessment? That we need to make sure that we are using the proper cuff size. So that's one big thing to think about. We also don't have good definitive cutoff values for diagnosis of hypertension in children. So that's something that kind of makes it a challenge as well. What are some labs we might check for these kids? UAs, BUN, creatinins, lipids, CBCs, electrolytes. What kind of assessments might we see on these kids? You guys should know these. Same things we see in an adult. Headaches, dizziness, changes in vision. Our young children that can't really tell us anything, you might see some increased irritability, rubbing of their head or banging of their head against something, waking up screaming really loud or crying really loud at night. Okay. So what do we do to help these kids? Well, we're going to treat their underlying cause for the hypertension. that's going to be our first line of defense. So diet. We might reduce salt in older children. It's hard to reduce salt and potassium and things like that in our infants. We may want to put them on calcium supplements. Decreasing in sugar in their diet, increasing of fruits and veggies. Of course, once again, exercise. Aerobic exercise type things would be good as well. Decreasing stress, decreasing their exposure to cigarette smoke. So helping them quit if they're smoking themselves, if they're the child, or helping the parents find ways to reduce the exposure of secondhand and tertiary smoke to their children. If we cannot get the blood pressure controlled by doing lifestyle modification, excuse me, and they're still borderline high or high, we will go ahead and try medications to decrease their blood pressure. We don't like to do these too soon because we don't know the long-term effects of being on these meds. So that's one thing to think about. Once we're on them, typically you're on them for a very long time, and starting these kids at, in elementary school on blood pressure meds, they may be on them until they're 60, 70, 80, late in life, or, until they pass away. So we don't know what that does to your body. Some of the meds we may give: beta blockers, calcium channel blockers, ACE inhibitors, angiotensin receptor blockers, and diuretics.